T4 stored in the thyroid gland is enough to maintain euthyroid state for 3 weeks to 50 days. That is why we order always thyroid investigation after 3 to 4 weeks. Okay, for repeat investigation. Core biopsy in thyroid is mostly done for Riddle's thyroiditis, lymphoma, and anaplastic cancers, where you need tissue for diagnosis. Okay, and the difference between the poorly differentiated and diffuse high grade thyroid cancer is, differentiated high grade thyroid cancer is, in poorly differentiated you have a SIT, that is solid insular and trabecular varieties with invasive features and no PTC features. Only invasion. SIT is invading, there are no PTC features, and at least one of the following, like mitotic count greater than 2 per millimeter square with necrosis and convoluted nuclei. In differentiated high grade tumors, the papillary, follicular, or solid pattern, PFS, piriform sinus type of pattern, that is differentiated. No? So it is papillary, follicular, or solid growth pattern with invasive features here also. And here it was in previously in poorly differentiated, it was only 3 mitosis. If it is greater than 5 per 2 millimeter square with necrosis. Okay, necrosis is common in both. If it is 5, you call it differentiated high grade thyroid cancer. If it is 3, you call it poorly differentiated thyroid cancer. Okay, and post surgery you wait for 3 weeks, let all the thyroid resources, okay, for 3 to 4 weeks, so that the TSH is mounted greater than 30. If the thyroglobulin is greater than 1 to 2 milligrams per millimeter, is associated with increased risk of recurrence or persistent disease. TG values post surgery 10 to 30 indicate poor survival. Fine. Recombinant TSH on the day 1 you give zero point 0.9 intramuscular injection of recombinant TSH. Day 2 you give again zero point 0.9 IM injection. On day 3 you administer radioactive iodine, and day 5 whole body scan is done. Okay, and iodine 123 has a half-life of only 13 hours. Low dose radiation, it's a low dose radiation with short half-life, with just in half a day everything goes away from the body, but it's not available in India. We generally use iodine 131, which has a t half of 1 week. Okay, which is available in India. Iodine scan, low dose scan is 1 to 3 millicurie scan with iodine 131, given. After that you wait for 24 hours and take a whole body scan with gamma camera. If there is greater than 0.1% uptake in the neck, it is considered significant. Greater than 0.1% uptake is considered significant. Eltroxin dose, the suppressive doses and the replacement doses. The replacement dose is 1.6 to 1.8 microgram per kg for replacement, 2.1 to 2.7 for suppressing. That is a suppressive doses. So SLNB studies, what we do is we inject the sulfur nanocolloid, 4 injections of 300 millicurie each, total 1200 millicurie on 4 quadrants of the lesion. That is a technetium 99 nanocolloid. After that you acquire for half an hour, 10 minutes to half an hour post injection, you do the dynamic imaging, the planar imaging, and you superimpose with SPECT CT to get the SPECT images with the CT scan to get the SPECT CT images. Okay. Narrow field laryngectomy is done for salvage cases with N0 neck. Salvage cases with N0 neck. Okay. Salvage cases with N0 neck.